An estimated 50% of all diabetes happens in those 55 and older. Seniors also tend to face unique diabetes management challenges, experience more notable symptoms, and have higher risk for complicating conditions. It's important that any person over 50 be aware of how diabetes might affect themselves or someone they love. So here to talk about diabetes, one of the most common disorders he sees in the senior population, is Dr. Wade Baggs, a board-certified internal medicine physician with Baptist Medical Group in Perdido. Thank you for being here.
It's nice to be here. It's a pleasure.
Well, what are the different kinds of diabetes that affect the senior population most frequently?
The most common type of diabetes that affects all persons of all ages, including the elderly, is going to be type 2 diabetes. That's going to affect about 90% of the patients who have diabetes are going to have type 2 diabetes. There's also type 1, which is less prevalent, probably making up about 5% of the total population. And then there's other hereditary and genetically mediated forms of diabetes. An example would be MODY, M-O-D-Y, maturity onset diabetes of the young, which also has a genetic basis in terms of insulin synthesis and insulin action. And then there's secondary causes. Certain disorders of the pancreas or disorders of the endocrine system can cause secondary diabetes.
Well, what should seniors know about treating diabetes?
Well, the most important thing is that when their diabetes is well controlled, they're going to reduce the chances of the micro and macrovascular problems, cardiovascular problems, that are the real problems with diabetes in terms of costs and effects on health.
Mm-hmm. Well, what kind of, how do people know that they have it? Are there symptoms? Is it something that their doctor finds with blood work? Tell us a little bit about how it's identified.
Well, as a general rule, it can be symptoms, and frequently in the acute setting they're going to come in with excessive thirst, excessive urination, maybe some weight loss, blurred vision, sometimes persistent yeast infections. But sometimes they don't have a whole lot in the way of symptoms, especially when it's mild. And in those cases, we'll use blood work and certain parameters that are established by the American Diabetes Association to make the diagnosis.
Mm-hmm. Well, we hear a lot and see a lot of advertisements on television about checking levels at home. Tell us a little bit about that, how frequently, what that actually means, and what it can help.
Well, actually, the ability to check blood glucoses at home actually revolutionized the control of diabetes, and this all came about some 25 years ago. Before that time, we had less sensitive methods for following a patient's blood sugar. As these new machines have become smaller and required less blood, we've been able to give patients the power over their disease by helping them to know what their blood sugars are at various times during the day. Usually the most important times we talk to patients about are going to be fasting in the morning and before meals and at bedtime.
Well, when someone comes to see a doctor, what information should they be prepared to provide, and what is the doctor also going to be looking for?
Well, the first thing I'm going to ask them is, do you have a record of your home blood sugar monitoring results? A lot of times they'll keep a diary and write it down in a diary, and sometimes they'll have it on the machine. They can just play it back on the little computer now. And we can look at the values and see if they're within the desired goal area or whether we need to do something different with their medicines.
Well, that desired goal area, how is that determined? Is that by age, by weight? What's the calculation there?
Generally speaking, there's not a big age difference in terms of the goals for the glucose control. We're going to be looking at things like the fasting glucose, the 2-hour post-meal glucose, and the hemoglobin A1C, which is a measure of the average glucose over 30 days. The American Diabetes Association has come up with goals on those values that we try to achieve with medicines, diet, and exercise.
Mm-hmm. So what are your goals as far as the medical management of diabetes for a senior or for anyone?
Well, the first thing is we're going to want to teach patients some basic stuff. First of all, it's going to be diet. It always starts with diet. weight loss. If you're overweight, you're going to have to lose weight. You're going to have to exercise. You're going to have to learn how to do home glucose monitoring. You're going to have to get a machine, learn how to do that, learn how to keep those numbers. And then depending on the type of diabetes and how bad it is, you know, we'll get into a lot of other medical treatment with oral agents and also with insulin.
Mm-hmm. Well, if someone, especially a senior, doesn't follow that advice, and sometimes we're all guilty of not really following the doctor's advice, what could possibly happen, though?
Well, first of all, they would develop symptoms that we alluded to earlier. They might become excessively thirsty, urinate frequently, be losing weight, have blurred vision. But in the longer run, the macrovascular complications of diabetes, as circulation to the brain, the heart, the kidneys, peripheral nerves, those sorts of things will develop at an accelerated rate.
So if somebody is, say, gotten off track on what they're supposed to be doing, how do you motivate them, or what do you say to them to get them back on track, and how do you do that?
Well, basically, we're going to emphasize, if somebody comes in, I'm going to ask them, you have your home glucose monitoring results? They tell me no, then we're in some trouble there. And so we're going to have them start doing that. And if they have symptoms of acutely elevated blood glucose levels, well, certainly that's going to clue us in that we need to get more data, more home glucose monitoring results. And then, you know, it depends on how high their sugars are. Sometimes they will require hospitalization to get back on track. Sometimes we can do it as an outpatient. It depends on, you know, how high their blood sugars are, how motivated the patients are, and just how good they are at doing home glucose monitoring and following their diet in other areas.
Okay, well, yeah, anything we can do to stay out of the hospital is probably a good thing and get us back on track. Well, what about technology here before we wrap up? Is there anything new out there that is helping you guys address diabetes?
There are a lot of new things out there. Some of them are being used and some of them aren't. For instance, there's been some inhalational insulin that's become available where you don't have to give yourself a shot, you can just inhale it. But it hasn't really taken on in this country. It's not very widely utilized, and I haven't used it in my practice. But there are some newer insulins out, some ultra-long-acting insulins and some ultra-short-acting insulins, which when we use them together very closely mimic the normal physiology of our pancreas and insulin secretion. And there's some new oral medicines out there, the gliptins, which are very beneficial for patients with type 2 diabetes because they don't tend to cause low blood sugar and they tend to promote weight loss.
Okay, well, that's great information. Well, thank you for being here.
It's a pleasure.
Well, we appreciate it.